One pill can kill. A serious warning for you tonight about the latest danger emerging in the opioid epidemic.
Cartels and dealers are making pills that look just like popular prescription drugs, only these are loaded with fentanyl. 25 Investigates got exclusive access to a DEA warehouse where evidence of these deadly fake pills are decontaminated and destroyed.
Anchor and investigative reporter Carrie Cavanaugh takes us there and shares one New England family's devastating loss.
Piece by piece, deconstructing a deadly threat claiming lives in our state and country every day. 25 Investigates taking you inside this evidence warehouse in an undisclosed location where cameras have never been allowed before. This is where the Federal Drug Enforcement Agency takes seized counterfeit pills and the machines that make them.
They're taking the pill presses that we've seized and they're decontaminating them.
The crew doing the decon wears hazmat suits.
This is a recent pill press.
This is DEA Special Agent in charge of the New England Field Division, Brian Boyle. And this is a pill press. It can quickly make counterfeit pills, stamping them to look like brand name prescription drugs.
Adderall pills, Xanax pills, painkillers. And what it is really just fentanyl. You could be a pharmacist, you could be a doctor, you look at these pills, you can't tell the difference.
So this one being an electric one, how many pills could it process an hour?
that could process probably 10,000 pills an hour. So you're talking, 100,000 pills a day easily.
The machines can also press fentanyl powder bricks that cartels market with other popular logos, anything that sells. Agents showed 25 Investigates some 11,000 fake pressed pills seized in Massachusetts in October in just one bust, all stamped to look like oxycodone.
The scary part is the overdoses. People are dying, and it could be anybody. Just one pill can kill now.
Let that sink in. One pill can kill.
My name is Fiona Farine, and my son Cameron, age 27, died of a fentanyl poisoning.
Fiona's son Cameron died in 2018. The Connecticut mom tells me he battled substance abuse disorder since the age of 14 when a doctor prescribed him OxyContin for a sports-related knee injury. She says for him, it was a recurring disease.
He asked it somebody he knew and trusted for OxyContin.
Cameron, you can't dance!
But the pill he got from a friend was a fake.
The dosage in Cameron's pill was 11,000 micrograms. So what we were told is that's 9,000 micrograms above the absolute death level. He didn't have a prayer. He didn't have a prayer.
Fiona says the medical examiner told them Cameron was likely gone before his body even hit the floor.
This can happen to anyone. This can happen to any family.
The DEA reports in 2021, more than 107,000 people died from a drug overdose in the U.S. 66% of those were attributed to synthetic opioids like fentanyl. In 2021 in Massachusetts, overdose deaths reached a record high at 2,290. And fentanyl is being produced in record amounts on an international scale.
They don't care about killing the population up here. They don't really care. They're all for making a profit.
Chemicals to create the fentanyl are coming from China to Mexico, where cartels are producing it. Then it's coming to the United States in powder form or already pressed pills.
I think the biggest message is if you don't get that pill from a doctor or a licensed pharmacy, then it could kill you.
Fiona and her family understand that message on a painfully personal level.
People are looking at it through stigma, and they're not understanding that people are not knowing what they're doing.
Why do you share this story?
You keep telling that story just to try to save others because this is an epidemic.
Fiona and her family tell their story through their nonprofit For Cameron. They work to educate law enforcement, change laws, and they're speaking directly now to high school students in Connecticut. There's even a scholarship in Cameron's name for people studying to be drug and alcohol rehabilitation counselors. And that's something Cameron was doing the year that he died.
Certainly your heart goes out to that family, Carrie. We're also hearing more about rainbow fentanyl, colorful pills that can be more appealing to younger kids.
Right.
Is that on the DEA's radar here in New England?
So the DEA tells me, it's definitely on their radar, but they say they haven't seen it yet in New England. Sadly, though, they say it's just a matter of time. All the more reason to talk to your kids and loved ones about what's out there.
Certainly is. Good reminder for all parents. Investigative reporter Carrie Cavanaugh, thank you for that eye-opener.